you didn't catch us in the beginning before we went out to breakout rooms, Empire, Missouri hosts their Friday forums on a monthly basis. And we're here today with Dr. Jan Mutchler to speak about the intersections of poverty and our aging populations. Jan is a professor at the University of Massachusetts, Boston, and her core studies focuses on conducting research in socioeconomic, cultural, and family-based factors as they relate to outcomes central to the well-being and later of life of our aging populations. That includes health, financial well-being, and family relationships. And additionally, her team produces and distributes the Elder Index, a cost of living measure for older adults calculating for every county in the US, and that is available at elderindex.org. So Dr. Jan will share a short presentation with us, and while there might be some clarifying questions pop up in the chat, please feel free to share those, and I can chime in as well to help navigate. And then at the end, we will conclude with a question and answer.
Great. So is it my turn?
Yes.
Very good. Thanks. Well, I'm glad to be here with you all. I'm not sure that I've talked with any groups in Missouri before about the Elder Index. We've been doing this work for about 15 years, and I've gone a lot of places, but I think this is my first opportunity to talk with a group in this area of the country. So I am, as Janessa explained, I'm Jan Mutchler. I'm a professor in the Gerontology department at UMass Boston, and we've been producing the Elder Index for about 15 years. I'm going to be talking about the Elder Index using, seeking to explain to you what it is and how it's calculated and how it's different from the poverty line, because you know, the way you measure something has important implications for what you learn from it and what kind of advocacy you put in place around the issue of interest. And so I'm going to be sharing information both at the national level and also for the state of Missouri. And as she said, Janessa is going to help me with sort of navigate the questions. So if you have a question as we go along, and it would be helpful to get the answer then rather than waiting till the end of the conversation, just put it in the chat and Janessa will yell at me and say, answer this question. All right, so I'm going to see if I can share my screen. And can you see it? Yep. Great.
Yes, absolutely.
Okay. Okay. All right. So let's start with the story. And this is a story that appeared in a number of news outlets a couple of years ago. And this story featured the woman that you see here. Her name is Fran Seeley, and she's 81, and she lives in Portland, Maine. Fran is a retired parochial school teacher. She gets $925 a month from Social Security and another $287 a month from an IRA. She's taken out a reverse mortgage that yields $400 a month. So in many respects, she's a pretty privileged person in the scheme of things. She's got, she owns a home, she has an IRA, she has a Social Security benefit, but she is struggling nonetheless. She's making it as long as she very carefully monitors her spending. She draws on her savings when things get short, and it's helpful that she's in excellent health. But she knows that anything that could happen, that happens frequently to us when we are in later life, things like a new health condition, something needs to be fixed with her home, her car needs repair, anything of those very typical circumstances, those things are going to impact her spending and they'll jeopardize her ability to continue getting by and staying in her home. And I'm sure everybody on this call knows or has been an older adult that has struggled financially or has worked with an older adult in that situation. And so this story, you probably are thinking of someone you know just like that. It's a very, very common circumstance. It happens to a lot of us. As we get older, we think we are doing the best we can to prepare financially for retirement, but we run short nonetheless. So even though Fran has all of these resources, she's at risk of financial insecurity. And that's because the resources that she has available are not sufficient to cover all of her necessary expenses. Now, by definition, when we're thinking about financial security, we shouldn't be thinking just about the resources we have. We shouldn't be saying, oh, this person is financially secure because they have a retirement benefit or they have Social Security and they have Medicare. We can't conclude that because they have a certain amount of money, they must be financially secure, because we have to think about resources relative to the expenses that people have to cover. Now, this is pretty obvious, and all of us live in that world where it's obvious every day. In our own homes, we have to think about how much are we bringing in, not in the abstract, but relative to our necessary expenses. But in the US, our most common indicator of financial security is the federal poverty line. The federal poverty line suffers from two critical flaws that make it very difficult when we're trying to use it to understand financial insecurity. First, it doesn't really take into account what older adults actually need. For example, health expenses are a huge part of many older adults' budgets, but it's not well captured, not well incorporated into the federal poverty line. So this is a particular flaw for older adults. And the second thing is that the federal poverty line doesn't take into account differences in cost of living across the country in different communities. The federal poverty line, the line below which you're considered poor and above which you are not, is pretty much exactly the same everywhere. Whether you live in Boston, like I do, or you live in a rural location in Missouri or in Idaho, the same number is used to determine whether someone is poor or not. And because that's the statistic that is produced and used by so many reporting agencies at the federal, state, and local level, how many people are poor, that gives us a very misleading understanding of how many people are struggling. Obviously, this issue is true across the life course, right? It's not just older adults that this is an issue for, but again, my focus is on older adults, and what we have done in our work with the Elder Index is try to produce a better indicator of what people really need to get by, a better indicator of those expenses, so that we can better evaluate them relative to the resources that people have. So, as I said, this is where the Elder Index comes in. So the Elder Index measures the income that older people need to meet their daily living expenses while staying independent in their homes. It's meant to be an indicator of the adequate income. It's not meant to be replacement income. If you've talked to a financial advisor or you've done work in the area of retirement, you probably are familiar with many financial advisors telling you you should be able to replace 70% or 80% of your income, something like that. That's not what this is. This is based on what constitutes an adequate income so that you can stay in your home in the place that you live currently. So that's what we're trying to do. It's not a lavish budget, it's an adequate budget. Some of the notable features of the Elder Index are, first, that it's built around a market basket of everyday expenses that are encountered by people 65 plus. So the first thing I maybe should have said a while ago was in this work, when we talk about older adults, we're talking about people who are 65 plus. That way we can assume that they have Medicare. And so that's an important assumption to be able to apply in every location. It is meant to be, again, a bare bones budget. We do not include any luxuries in this budget at all. We don't include things like going to see your family or taking your grandkids to the movies. We don't include any of that. It really is just the most stripped down budget, and you'll see the details in a minute. The Elder Index assumes that people are living independently, and by that we mean they're either living alone or they're living with a spouse, partner, or other older adult. So if for instance, financial circumstances have resulted in them living with an adult child or having others move in, we don't consider them in the calculation of the budget. It's just people living alone and in a two-person household where both of the people are 65 plus. It assumes that people need to pay for everything out of pocket. And so we don't factor in the subsidies or benefits that may be available to people at lower levels of income. Those thresholds are often different across states, and we're really wanting to just estimate how much people need to have in order to cover their expenses out of pocket. And then importantly, we calculate the elder index county by county for the entire United States. So we do factor in that geographic difference in how much it costs to get by. So essentially, we offer an estimate of how much it takes to age in place in one's own home if everything has to be paid out of pocket. Okay, so I'm going to start sharing some data with you about the Elder Index. And again, we've been producing this and disseminating it for about 15 years. And today my focus will be the 2023 Elder Index. I'm starting with an empty table here so you can acquaint yourself with what it is that we do before you get overwhelmed by all the numbers. So our basic approach is to estimate the value that goes in each one of these cells, and then we can sum them up to a budget. Okay. So we stratify our estimates by whether we're talking about a single person living alone or an older couple. And again, we're not assuming they're married. We're just saying two people, both of whom are 65 plus, living together. We stratify it based on whether they're an owner or a renter and whether they still have a mortgage or not. We also stratify by different levels of health status. All of the calculations I'm going to show here assume good health, but we also generate elder index values for people in poor health or in excellent health. So once we've calculated all of these cell values, we can add them up to an elder index budget on a monthly basis and on an annual basis. When we do that, the national average looks like this. Excuse me. So what we have in these cells are the monthly values. So the on average across all of the counties in the nation, a renter pays $1,100 for housing. Okay, that's the average across all the counties, weighted average. It assumes a one-bedroom apartment. It includes all of utilities and any taxes that might be embedded in your housing in the case of property taxes. We have an assumption for the cost of food. This is based on USDA rates, transportation based on an estimate from surveys. Healthcare expenses are based on Medicare data. And then miscellaneous is a very small increment. It's a 20% increment to everything else that is meant to cover things like shoes and household supplies. Again, just a very stripped down budget. It doesn't include any luxuries at all. So when you look at these values, you can see some, there's a sort of pattern going on there. You can see that it's clearly most expensive to still have a mortgage, to own a home but still have a mortgage. The least expensive is to own a home without a mortgage. Renters are typically in most locations around in between those two values. And I think a lot of what we'll be talking about today focuses on those renter values, which is really important because for a number of reasons, one of which is it is sort of a central point in this distribution of costs. Another is that it really is a common and important downsizing opportunity for older adults to move into the rental market. It's also a very vulnerable place for many people, but perhaps particularly older people to be living in that rental market. And of course, lower income people are far more likely to be renters. So that's where we're going to focus much of our attention there. Okay, so this figure illustrates what the elder index looks like for the US. That's the US average that we just saw in these two bars, and compares to Missouri in these two bars. So you can see it's just a stacked calculation of the 5 cost categories that we looked at before. These are annual expenses. And we're assuming people in good health. And we're just looking at people living alone. So single people living alone. So when we compare all of this, you can see that the estimated elder index value is somewhat lower in Missouri than on average in the US. It's clear, excuse me, it's clear that that difference is due largely to the cost of housing. Okay, and that's true whether we're assuming owners with no mortgage or renters. There are some other differences that we'll see here and there as we go through these figures. But in every location, every state, the cost of housing and the cost of healthcare is what drives the elder index value most substantially, and also drives the differences across locations most substantially. So you can see here, we'll see the numbers later, but right here, the cost, we're looking at, let me make sure I get it right. So we're almost $25,000 a year for owners with no mortgage in the US. It's closer to about $23,000 for similar people in Missouri. For renters living alone, it's about $30,000 total for the US and closer to $25,000 for Missouri. So you can see just when we're talking about, again, a stripped down budget, a low income budget, we're seeing some important differences there between the US average and the Missouri average. And it is a function heavily of housing. An important point to make here is to loop back to that point. Yeah, I love it when I can see people shaking their heads, Sarah, thank you. People who work on low income, they know all of the flaws of the federal poverty line, right? But I think it's important to remind ourselves of that, maybe frequently, and I probably will do it frequently today. But, you know, I've already laid out the logic of calculating the elder index. This is not a lot of money. This is not a lavish lifestyle. It's a much more realistic indicator of what people need in order to get by. And yet, so much of what we have to work with in research, in advocacy, in policy, focuses on this poverty threshold, which is so low in absolute terms and certainly low relative to the elder index. So that was my point from this. The cost of what it really takes to get by is far higher than what the federal poverty line would suggest it is. I'll just really quickly go through this because it's just the parallel result for couples, and you can see the same sort of pattern. Costs are a little bit less in Missouri than for the US average, continues to be heavily about the cost of housing, and in all cases, it continues to be much, much higher than the federal poverty threshold. Okay, so we've been talking so far about the US average and the state level average for Missouri, but I do want to remind you that the elder index is actually calculated at the county level. And so I wanted to just share one sense of that. And I apologize, I'm not really sure I've ever been to Missouri. And so I hope I chose familiar counties. We'll hope for the best anyway. I tried to look them up. You can go to our website, elderindex.org. It's got data for every county in the country. You can get all of the information that's included in these figures. You can get it there. It's you can download it. It's free. It's easy. There's no advertising on it. It's great. So what we have here is we have that Missouri average again. Our focus here is just for single renters. Our Missouri average is here, and we have 4 counties to compare it to. Polk County is, for this scenario, is actually the lowest cost of living in Missouri. So it sums up to just over $22,000 a year. Taney is kind of in the middle. St. Louis City, you know where that is, and Jackson County is close to the most expensive, close to the top of the distribution. And I guess that's where Kansas City is. Is that right? Did I get it right? Yay! I love Google. So, so anyway, it's sort of, we see the distribution there. We see that even within the same state, you have a pretty big difference from the low end to the high end. So again, when we go out, we're working in a state, we're doing advocacy, we're doing research, we're trying to talk about quality of life or affordability of, what constitutes a standard of living. And often we just don't have adequate tools to do that, things that will bring in an understanding of what it really takes to get by. And the Elder Index is meant to fix that. The Elder Index is meant to address that for the older population. So we see a range across counties within Missouri of more than $5,000 in the resources that are necessary to cover essential expenses. And in all cases, in that comparison, we're talking about a single person, good health, renting a one-bedroom apartment. And in all cases, the cost of housing and healthcare are what are driving those differences most substantially. And in all cases, that poverty threshold is still just way too low to adequately reflect what it takes to get by. So I think our takeaway up to this point is that economic security requires considerably more financial resources than staying out of poverty does. If we want to talk about adequacy, if we want to talk about independence, we want to talk about being able to cover the essential expenses of living, we can't count on the poverty line. We have to do better. And this, again, was one of the goals of developing and producing the Elder Index, to really stop using measures that talk fundamentally about destitution and start talking about financial security, talk about adequacy, sufficiency. Okay, so I've shown you a little bit about what the Elder Index is and how we calculate it. And many stakeholders use it for that purpose. So I know in many states, they use the Elder Index to explain to stakeholders where what a more reasonable threshold of adequacy is, something that does better than the poverty line. It's very helpful in explaining to older adults themselves, this is why you're struggling. This is how much it costs to get by. It's not your fault. This is what cost of living is in your area. It's very useful in explaining to state legislators or local community leaders. This is what it takes for people to stay in this state, to stay in this community. But another very common use for the Elder Index is to compare it to the money that people actually have, the resources that people actually have, to begin to tell a story about, well, how many people really are struggling? If we know the poverty line is too low, then we know that our poverty rate is also way too low in terms of telling the story about how many people are struggling. So using the Elder Index is a way that we can use a more accurate threshold and thereby give a more realistic story of how many people are struggling. So again, this is just a depiction of what I'm talking about here. If you use the federal poverty line, which again is just 14,614 in 2023, then you get the poverty rate, or the people who have incomes below the federal poverty line. If you use the Elder Index, you're looking at a more comprehensive understanding of what it takes to get by, and you're going to yield a more accurate understanding of how many people may be struggling, who are financially insecure. Okay, so in the next two figures, I'm going to share what we learn about financial insecurity in Missouri. And again, the figures are calculated by comparing the Elder Index for Missouri, and we're just using the statewide average here, to the incomes that older people have available to cover those expenses. And so the income that we're using is everything that they report as income: Social Security, if they have a pension, if they have a job, if they have savings that they keep drawing down, whatever they have as income, we use that in calculating this ratio. So the first thing we find, and unfortunately, none of these figures will surprise you. Okay, it's a familiar story, but again, it's a story that I think is impactful in its magnitude, we'll say. So this suggests that a large share of older adults in Missouri are struggling to get by. They have incomes below the elder index. In Missouri, 45% of women living alone have incomes below the elder index, along with 38% of men living alone and 18% of older couples. So it's clear that a large share of these older adults are struggling, just like Fran, the person in your the first slide I shared, the person in Portland, Maine. She may not be she may be just struggling from month to month to make sure that she doesn't encounter unnecessary or expenses, unexpected expenses. Many people are going to be in that situation in Missouri and elsewhere. So this pattern that we're seeing here is not unique to Missouri. It's not unique to any particular location. In every single state across the country, singles have higher rates of financial insecurity than couples do, and single women are at particularly high risk of financial insecurity, according to the Elder Index. I don't have numbers to share with you here, but it becomes particularly pronounced when you're looking at the oldest women. When you're talking about women who are in their late 70s and into their 80s and beyond, and living alone, the share falling below the elder index is particularly high. So I don't have the numbers for Missouri for these groups to share with you in terms of how these compare to the share falling in poverty. But nationally, if we look at this group, the women living alone, nationally, the poverty rate for those older women living alone is 18% compared to the 45% falling below the elder index. For men living alone, it's 15% falling below the poverty line. So you can see it's easily twice or more falling below the elder index relative to what we commonly talk about in terms of financial struggle based on the federal poverty rate. We also see substantial disparities in financial security across race and ethnic groups. The figures I'm showing you here all refer to single people age 65 and over living alone in Missouri. And what we see is 40% of the non-Hispanic white people are falling below the elder index, along with 58% of the non-Hispanic Black people living alone and 44% of the Hispanic people living alone in Missouri. Once again, this pattern of disparity is not unique to Missouri. Compared to the US average, the percent below is a little bit lower in Missouri than at the national level, but just by a few percentage points. It's actually a lot lower in Missouri for Hispanic than the US average. I don't know why. It would be an interesting thing to find out, but just noting that it is lower there. And nationwide, we have figures for the Asian population, which is fairly close or fairly similar to what you see here for the Black population. We don't have those numbers for Missouri because the number of cases we had to work with were not sufficient to support that calculation. So the good news is in both of these figures that we looked at, the share of older adults in Missouri who are struggling financially is not as high as in many other locations across the US or the US average. But the bad news is that it's still really high, and it's far higher than what we might think it would be based on the poverty line. And it's especially high for people living alone, older women living alone, racial and ethnic minorities, and as I said, the oldest old. I'd like to share one last figure that further illustrates the geographic disparities in financial security. And what I've done here is calculate a ratio of the average Social Security benefit in a county to the elder index. So it essentially says, how far does the average benefit for an older worker go towards covering the expenses for a single person based on the elder index? Okay. What we see is that the lowest coverage, the poorest coverage, where that Social Security benefit falls most short of what's required to cover necessary expenses, those are shaded in the pale yellow. And where it goes the furthest is shaded in this darker orange color here. And you can see Missouri in this general area. It's kind of hard to the states aren't outlined very well here, but it's in that vicinity. And so you can see really a mix of counties where the coverage is on the higher end of the distribution and the lower end on the middle end. But what you should know is that there's not a single county in the entire country where the average Social Security benefit is as high as the elder index in that same county. So everywhere, no matter where you are, Social Security is falling short. Some of the reasons are going to differ from some places to another. So if you look at California, you look at Alaska and Hawaii, you say, well, of course, the cost of living is incredibly high in those places. And so Social Security is going to fall short. If you look on the border of Mexico, you probably know that the cost of living is not very high on the border of Mexico, but the average Social Security benefit is very low. And so what we're seeing is, what does that balance between the cost of living, and again, especially housing, especially healthcare, the cost of essential expenses relative to the average Social Security benefit that people have access to? What does that look like? And you can see that there's just a lot of variation across the country, as well as within Missouri. My last chart here will just return to that point about that balance of resources to expenses and where the federal poverty threshold fits in this whole distribution. It's very often said about Social Security that it lifts so many older people out of poverty, and that's absolutely true. You can see the average Social Security benefit across these same 4 locations that we started with, listed across here, and you can see again that federal poverty threshold is the same everywhere, but clearly that Social Security benefit is higher than the poverty line. And so people are indeed being lifted out of poverty through their Social Security benefits. But if you plug in the elder index and look at that instead, you can see where that Social Security benefit is falling short of what it takes to get by. Here it's ranging from about 80 to 86%. So there's still quite a lot left to cover. And in dollars, it ranges from about $3,000 to more than $5,000. That's how much they would have to bridge if someone lives in Jackson County. They have the average Social Security benefit. Their budget aligns with the elder index for their county. They need to make up about $4,200 every year, one way or another. It's not going to come through Social Security. They're going to get a job. Maybe they have a pension. Maybe they can devise some other way. For many, as we know, the way they bridge that gap is they don't fill the prescriptions that they need. They don't run their heat. They don't run their air conditioning. They fall behind on payments. They might go into debt. Okay, so because the inflation numbers came out yesterday, the latest information on inflation, I just had to say a word about that because the elder index has gotten a lot of attention in the last couple of years because inflation has been going up so much, and it's been impacting especially some of these really essential expenses that are embedded in the elder index. And what we saw yesterday is that food, year to year, food continued to go up by 1.2%, shelter by 5.7%, healthcare by 2%. Those costs just keep creeping up. And as we know, the escalation of resources does not go up at anything like that level. So again, we know that most heavily impacted by these shortfalls and impacted by the inflation that we've been experiencing in recent years are going to be the single women, the people of color, the oldest old, and especially perhaps those living solely or mostly on Social Security. So I appreciate your being here today. And as I said, you can find all of the information on the Elder Index at our website. You can learn about it at the UMass website. We have a lot of reports and things of that nature on there, and you can just reach out and contact me if you have questions or would like to talk about the Elder Index. So I know that there are some people on the Zoom who are much more informed than I am about policies or issues, things that are going on in Missouri. So I'm happy to take any questions or participate in any conversation about the Elder Index in general, but I'm sure other people can chime in if there's a comment on things that are going on in your area. Or not.
I was just gonna say thank you. We reference the Elder Index quite a bit here at the St. Louis City Senior Fund. We're a levy fund, one of the levy funds in Missouri. And I try to emphasize that this is the bare minimum. So this is not someone needs a home repair done, or something happens with their vehicle if they happen to have a vehicle, or and so I find it really helpful for referencing and talking about it, and talking about then how many residents have, or how many people in our city have incomes that aren't even close to the Elder Index.
Great. I'm glad to hear that. Thanks for that. Oh. Karen?
Yeah.
So
Yeah, go ahead, Karen.
Hi, I was sharing with our breakout group that the organization that I'm with, American Association of University Women, our average member is 72.
Mm.
The data that you just shared is startling, and I think I heard you said this was all based on someone that was healthy. So do you have any data about people that are facing some medical issues? I just know I'm very fortunate that all my friends aren't. So this was very enlightening, and I'm anxious to share this, and I'm glad I met some colleagues in our little breakout room that I'm going to be touching base with.
Great, great. Thank you. We calculate the Elder Index. Again, I shared the information assuming good health, but we calculate it for when we assume poor health or when we assume excellent health. And so you're right. When someone is in poor health, those health expenses can go up a lot. Now, the one thing that we don't include in the Elder Index that's an important omission, an important thing to keep in mind, is long-term services and supports. And so if someone needs home care, certainly if someone needs assisted living or, some kind of very significant package of resources, we have from time to time generated estimates of that for different locations, but that's not part of the Elder Index. So when you get on our website, you look up what happens when I assume poor health, you'll be even more startled. And then when you remind yourself it doesn't include any home care or anything like that, you'll be distressed. So
Thank you. I appreciate it.
of course.
Jan, this was a great presentation. Thank you so much.
Yeah.
And it not only identifies that, when people think that older adults, because they receive Social Security, that they're taken care of from an income perspective, but also, as Karen just pointed out, that Medicare pays for all your healthcare expenses, which we know it doesn't, and it definitely doesn't pay for long-term care services. So to think that an older adult is taken care of from a medical perspective as well, it's just not right. It's just not there.
Right. No, absolutely. I agree. And people are always surprised when they actually dig into the numbers and have a conversation about it, all the misperceptions that they had. So it is it's a helpful tool to really begin conversations.
Jan, first, congratulations on what appears to be very, very good research. I and a couple of other people on this call are associated, excuse me, with something called Missouri Master Plan on Aging. And several of us are also affiliated with the Missouri Silver-Haired Legislature. I'm not sure if you get specifically into these kinds of things, but do you have any general policy suggestions that the Master Plan on Aging, which encourages, aging independently at home and proper access to healthcare, et cetera, what kinds of policies in general you might recommend to us?
Yeah. I think in terms of aging specific policy, perhaps where I've seen it used most effectively is in increasing the income threshold for eligibility for like Medicare savings programs, things of that nature, and also reducing or eliminating asset limits for those kinds of programs to just sort of make the case about lower income people still struggling, some of whom have a home, but that's really all they have. And so trying to protect that ability to age in place. So I've seen that work. I think the other place that the Elder Index has been used is, I think, as I mentioned, is really just in terms of educating people about what it takes to get by and inviting reflections on what can we do to provide more affordable housing, not even necessarily using the technical, affordability thresholds, but just understanding that so many people are living in situations where they can't afford to stay in their homes, they can't afford to downsize and stay in their communities, and that is just such a big part of the necessary expenses. So I think that, in policy communities, I think it's been used around setting those thresholds for eligibility for different kinds of programs and motivating thought processes or imagination around how can we do better in terms of providing housing, how can we do better in terms of supporting senior centers or other kinds of organizations that provide things like food, lunch programs, transportation programs, things that will nibble away at some of those essential expenses.
Thank you. I just wanted to let you know, I'll see to it that your research is passed on to some of our upper level people at the master plan also, because I think they would benefit.
That's terrific. I appreciate that. I hope it's helpful.
It appears very good.
Very good. Thank you.
Well, if that's all of the questions that we have, Sarah just dropped the link in the comments about a survey. So please, if you could take a few moments just to fill out that survey. It also includes a prompt to, if you want to further this discussion, if there's other intersections of this conversation that you would like Empower Missouri to explore. That survey gives an opportunity to give those answers. So yeah, if you could take a few moments to fill that survey out, we would greatly appreciate it. And we also obviously want to thank our speaker today. That was incredibly informative. Just a lot of information to take in, especially when we consider what we have been discussing across our state and in our 3 coalitions that we host, between food accessibility, affordable housing, and also criminal justice reform. So yeah, I want to take a moment and say thank you, and we appreciate you joining us today and sharing your presentation and your research.
And I do want to make sure and share, Jan was fine with us sharing her slides from today. We'll send those in follow-up. We'll send a follow-up email with the recording from today as well. So you'll have access to all of that.